Tony, thanks very much for agreeing to have an interview. Could you please introduce yourself in terms of your role at NHS England and what the NHS England Clinical Entrepreneurship Programme involves?
Sure, so I'm Tony Young, I'm a consultant surgeon in the NHS, the Chair and Director of Medical Innovation at Anglo-Ruskin University. I'm a lapsed healthcare entrepreneur. I've done 4 startups myself in the past, but I'm also a National Clinical Lead for Innovation at NHS England, helping the NHS to adopt and scale the latest, greatest technologies that are proven to improve both quality of patient care, patient safety and cost efficiency in the system. And I also run the Clinical Entrepreneur Programme at NHS England, which has become the world's largest workforce development programme for clinicians, teaching them commercial skills, knowledge and experience to help them transform healthcare. Now this programme is open to everyone from medical students right through all grades of clinician now, and even open to other members of non-clinical staff, managers and other people in the NHS who really feel they may not just want to be entrepreneurs but perhaps intrapreneurs too, so to learn that commercial skill, knowledge and experience from the entrepreneurial and startup commercial worlds to try and help them transform healthcare, to look at new ways of doing things.
Okay, so we're on the cusp of really quite significant changes in healthcare, where you look at things like artificial intelligence, big data. What sort of things should medical students be doing? Say the new intake of medical students in September 2019, what should they be doing now to future-proof themselves for their working career in 5 years when they come out of medical school?
Sure, so I think the most important thing is learn how to learn and learn how to learn new things. The facts and knowledge that we currently have now that often curricula used to be based on learning those things, they won't be true in 5-10 years time down the line, but learning how to change, how to adapt to new things that are going on. It's difficult to keep pace with the rapid changes that have been in areas like AI that you were talking about just now, and they are going to transform care pathways in the next 5 to 10 years. And the current things we do, particularly the mundane, routine, repetitive things that clinicians are often doing, are more and more likely to be automated and run by systems. So we're getting less variation and much higher quality care. But being involved in programs like the Clinical Entrepreneur Programme, which gives you a broad introduction to not just AI and wearable tech, advanced technology, digital and health, different kinds of platforms, connected devices, and things that plug into your smartphone, all those sorts of things. But it's also about how do you deploy that? How do you take that up? How do you transform a care pathway or take that forward? Because it's all very well having these latest greatest things, but if no one's using them and they're not using them at scale. So for example, why, even though we've had handheld ultrasounds for a long time, it's not broken through, and clinicians aren't using it as the new stethoscope every day in practice. And I'm not sure I know what the bit of human insight is that's going to transform that process. But actually, now that you can plug an ultrasound probe into your smartphone, perhaps that's going to be the technological step that unlocks things for people, and then with the appropriate training regimes put in place. So entrepreneurs who are on the programme now aren't just developing new digital health platforms or technology offerings, some of them are educational opportunities, looking at how we train and upskill the workforce in different areas, and how we utilise technology and bring that together is going to be one of those things.
Okay, so that's really interesting. From my perspective, when I was a medical student 10, 15 years ago, and then when I spent a long time teaching medical students, the same questions that I was asking and we were unsure about were exactly the same things that medical students that I was teaching were asking. So how do you think, one of the first things that you said was how people learn. How can being on the entrepreneur programme, what kind of opportunities would a medical student coming on this help them develop those skills?
Oh wow, so I'm quite passionate about how we've traditionally selected people for medical school. May have served us well in the past, but does it serve us well in the future? Certainly when I came in, it was you were judged on how many amazing external activities had you done, whether that was your Duke of Edinburgh award, or you were a musician, or you've done all sorts of things. But then you come into medical school and it sort of puts you in this funnel process, and you come out at the end of it as an FY1 doctor. Almost like clones of one another. So we've almost taken off these beautiful rounded things that made you an individual, and things that gave you meaning, that you felt passionate about, that helped you think this is the right thing for me. And we wonder why 5% of doctors leave training permanently per year, and I think last year it was 56% of doctors at the end of FY2 were taking a pause and a break from their careers and looking at what they wanted to do. So the beauty of the entrepreneur program is, if you've had that dream, that little secret that you've been holding inside, and actually says, do you know, I want to not just look after the one person who's in front of me and make a difference to their lives, but I also want to try and impact the lives of millions. And this is a paradox. How can you make a difference to the person in front of you? You can do that as a doctor, but to affect millions? Well, as a clinical entrepreneur, someone who is a clinician in the NHS, but also develops and does something amazing in the healthcare technology startup space, you can do both things. So on the entrepreneur program, you can learn those skills, that knowledge, gain that experience, but you will also meet the most amazing crowd of other disruptive, innovative, entrepreneurial people, and you'll find co-founders. People are starting to found companies on the program. In our first 2 years, we had 113 startups founded on our program. They raised £118 million between them. And what's so cool about that is that's £118 million that the NHS didn't have to take out of patient care to put into innovation to try and develop new things going forward. So that's a really great thing to do. And but I won't have all the latest, greatest ideas, but if we empower the workforce, the most valuable asset we have in the NHS, and that starts at the undergraduate level. So more universities are looking at how can we put in student selective modules for undergraduate entrepreneurship or intrapreneurship. Master's degrees and called postgraduate certificates are starting to be developed in this space. So it's a really exciting space because, so I was never taught at medical school about basic accounting, spreadsheets, profit and loss, legal and regulatory issues around these things. But as I've become a clinical leader, I've needed to understand these things more and more, and you will learn that on the Clinical Entrepreneur Program.
Fantastic. Just to summarise, I think it's interesting you made a comment where when medical students go into medical school, they have the ambition and they want to change the healthcare of millions of people, and then that's kind of chopped away from them, and as you said, they come out as these very homogenous units to complete tasks and work. So yeah, getting medical students on the entrepreneur program is you would welcome, and you'd say, because some students might feel a little bit daunted by the
I'm not saying the current medical education and training system we have at the moment is not fit for purpose or anything like that. It does really well, and it turns out safe doctors, and we have to do that. But can we do even better? Can we address some of the challenges we face now by doing even more? So we do need to do what we're currently doing at medical school and turning out high quality, safe, appropriately trained doctors. But can we go that one step further and actually give them that joy in their lives about going to work? Now, for some people, it's going to be about being an academic and doing research. For some, it'll be about being a leader. For some, it'll be about being a teacher. For some, it might be about being an entrepreneur or an intrapreneur. And if that is those latter two, then this program's for you.
Fantastic. Well, thanks for your time. Really appreciate it.
Thanks a lot.
Cheers.